Welcome, everyone. Thank you for joining us today for what promises to be an important and insightful conversation about advancing oral care for children with sensory sensitivities. I'm Katya Kletter. I'm brand director here at Willo, and I'm thrilled to introduce Dr. Carter. Dr. Carter is a pediatric dentist and orthodontist with dual certification and expertise in treating patients of all ages, including those with special needs, and hence why we invited her to talk to us about her experience. She has a private practice in Madison, New Jersey, and she's an assistant professor at NYU College of Dentistry. She's a board member of NYU Oral Health Center for People with Disabilities and is a named top doctor by New Jersey Magazine and favorite kids doctor by New Jersey Family Magazine. Welcome.
Thank you. Thank you. I'm excited for today. I love sharing some things that make our patients' lives easier. And by making our patients' life easier, we are able to help our providers and our families. So children that are neurodiverse or have sensory sensitivities can have some different challenges. We have up to 15% of all children in the United States with sensory issues, and those numbers are on the rise. So what are sensory sensitivities? They're reactions to sound, taste, texture, light, everything. And if you think about what happens when we go to the dentist, we violate every single one of those senses. Things smell funny, it tastes funny, it feels funny, there are vibrations, it's gritty, we have gloves on. And so we make it really difficult for them, but we can make it easier for them. Many children with autism have sensory processing disorders. And we know that autism is now 1 in 12 children in California and 1 in, I think it's 22 in New Jersey now. And again, those numbers are increasing. So these are things that we need to learn how to tackle and learn how to empower our children on how to overcome this. Okay, it can really be difficult for cleanings in the office, but also for daily routine cleanings at home, where they just don't like the feeling or the time or the taste, or they just stand there. We can tell them to go brush and they will brush, but any child, whether with some challenges or not, knowing how to brush, where to go, and to touch all of those teeth effectively is always a challenge. So some children with ADHD, routines or staying on task is very hard. So we need to find visual targets and ways to channel their energy to help them conquer the task that they need to achieve. Because we know if we are not able to keep teeth clean, then we're going to have decay. And then we have other issues that we need to tackle. So if we don't brush well, we will have poor habits. We will have anxiety because we're not aware of what's going on. We feel like we're failing and we have more work to be done. And oftentimes it's just too overwhelming and we have just avoiding going to the dentist at all, which we know just has more problems. So how can oral health be impacted? You know, we see these pictures of children and they're not really holding the toothbrush or touching everywhere, but we need to teach them how to do this. So we talked about how we violate every aspect. So how can we make it better? We need to have sensitivity to the textures and the pressure. So part of it is training and learning it. And sometimes it's the taste. So having different options that are mild flavors and also mild textures that have fewer chemicals or SLS in it, less foamy, can make it much easier for children. By lacking SLS and that foam, it's less stimulation. So we're able to make toothbrushing that much easier and we decrease that resistance. Now, as we create habits and as it becomes less of a deterrent, it becomes much easier and it becomes, the mouth becomes less defensive and everything gets easier. So we can actually have a pathway to healthy habits and healthy teeth. So brushing teeth is often hard. Sometimes 73% of parents with autistic children report that toothbrushing is difficult once a day. When that's the case, we advocate, please just do it at night and after at night, only water, nothing else. Sometimes we have to recalibrate our achievable optimums, but getting that nighttime brushing, we need to help them with. But only 50% of those patients brush it twice a day. So sometimes just getting that one really good brushing, yes, we want twice, but if we can do it and get them successful at once a day, it's easier to build them to twice a day. So baby steps will get us there. So how can we make it easier? We need to make things predictable, that it's going to be the same every single time. And we need to have visual targets for our children. They really respond very, very well. We add timers to our toothbrush. And not only that, but on the Willo, it actually shows you how much time is left on the top and how much time is left on the bottom. So it's not just saying, oh, a little bit longer, a little bit longer. They can see and retrain to know exactly what's going on. We can also, make it fun with songs or have different signals. We can have routine charts and all those different things. We all have our tricks of the trades and what works for each child. Having softer toothbrushes make it more comfortable. Power toothbrushes with a low vibration without sonic are also much easier to adapt. And we can have different flavor toothpaste to select from. Positive reinforcement works well for everybody and everything, from dogs to children to adults. And so having those little badges that appear and little rewards and showing our, streaks, they do it on Peloton. So why can't we do it on toothbrushes to really keep us motivated? Can also help. And then as we practice and we get better at it, things become easier and far more fun. And then we can have an even better way at home. And that resistance and that fight and that dread turns to fun. So how can Willo make the toothbrush even better? So it's proven, and we have studies to show you, that it's 7 times more effective at removing plaque and all the hard to reach areas. So we know children will get the bottom teeth fairly well, but they don't like to get the front and they don't like to get all the way in the back. So with one placement of our Willo, we're able to get all of those areas equally clean. We get in between, in the grooves, pit and fissures, interproximals, buccals, linguals, everything. It's controlled with just the proper amount of pressure, and we hit all of those areas. So it really does everything all in one. Now, this really is a disruptor. We've all seen different types of toothbrushes, but they don't work. And this really shows that if you place it in the right position, holding it up, every side of that tooth gets clean. I've seen it in our plaque studies, and we can show you too. So is it comfortable? Sometimes they don't like that feeling. Well, this very soft bristles, and we go everywhere, and it's 34,000 bristles. So it gets into all of those tough spots. And it's because it's so effective, we can do it in a minute on the top and a minute on the bottom, because we're getting everywhere. And it's not just a few seconds on each site. It's a full minute brushing every site, and it's super comfortable. So what about tastes? That's always an issue. We have berry, we have bubble, and we have a mild mint. And they're quite tasty. I've tasted them. My whole office has tested them. I've tested them on my patients here, and they all love it. They really do. It's SLS-free, so we don't have all that bubbling, and we don't have to worry about that interaction if some children are SLS sensitive. And we have wonderful taste, wonderful flavors, and we don't have to worry about texture. Because the toothpaste flows in between the bristles in our mouthpiece, it's connected to a little hose that goes right into the sink. So it's not messy at all. Sometimes children who are sensory don't like the feeling of things dripping on their mouth or spitting out. This does it all for them. And sometimes they don't necessarily have that ability to spit. So it takes care of that for them too. It removes everything and it goes right down the drain. So the child's happier, the bathroom's cleaner, parents are happier too. So with less effort, we get a much better response. The only coordination needed is holding the toothbrush up. And a child can do it, or if it's really complicated for some children with their dexterity, an adult can do it. And you can see here that that color shows you how much longer you need to brush and then tells you when to flip. So it's not a parent saying, go back, go back. Did you get the back? Did you get the front? Did you go over here? They just need to put it in and hold it. And you can see right there in the video, the color changes and you can see how much longer you need to go on the top. It tells you to flip and then it tells you when to go on the bottom. And there are two brushing modes, one for clean and one for scrub. And children can pick which they like to feel better. Children love electronics, and it is linked to your phone or your iPad, and it is a great report card. And it shows you how well you've been doing, how frequent you've been doing it. So there's no more, I did it and they didn't do it. And you can see, so it's less nagging, more consistent, and children get motivated by this. Everyone wants to earn their checks and see all the rewards that they get.
What do you think about that?
I don't like it. Toothbrushes.
What do you think about that?
I don't like it.
Okay, what did you like about it?
Is how it brushes your teeth for you. You don't have to move it.
Don't have to move it. Does it taste all right?
Yep, it does.
Does
Tastes
it
like
hurt?
cake.
Does it hurt at all?
It does not hurt.
Is it too loud?
It's not
Sensory friendly.
loud.
Oh, I think we need to go back. He loves it, is what he tells us.
Were you able to hear it?
We need to get the tech gods to help us today. He actually says, I don't like it. I love it. It's so fun and I love it. And that's what he says in this. And you can see from these other parents over here that he doesn't seem to mind brushing. Justin in the US. My autistic son doesn't like brushing his teeth at all, but he doesn't seem like brushing. So he's happy that he can use his Willo for a full 2 minutes without complaining. And you can see on the replay that this video, we'll have it play there, or he actually says it's really fun and I love it. He's holding it up and his teeth, he comes in and he shows his teeth and his teeth are beautifully clean.
Apologies, it was playing on my end. On all devices.
So why is the Willo so great? It really is effective at creating routines that can be challenging for neurodivergent children, non-neurodivergent children, and their caregivers. So just creating that routine is key. We're inspiring them with that report card. We're inspiring them with their badges, and they look forward to doing this. It can lead to not brushing well, can lead to poor oral hygiene. So having this routine and having all sides of the teeth touched means that we gain confidence and we decrease our anxiety. Under the age of 12, 24% of all children have anxiety. So if we can reduce one thing that is increasing their anxiety, we're really providing a gift. We're also setting them up for a lifetime of positive experiences and positive mindset towards dentistry and dental care and personal care. And then the Willo makes oral care simpler, stress-free, cleaner in the bathroom, and more effective. And it gives patients and parents confidence that they're brushing their teeth well. When teeth are brushed well, the dental provider is happier. There are fewer things that we need to nag them about, because that's all we do. All we do is nag to get them to do better. And we're able to praise them for their improvement and their beautiful, healthy smile. So by turning brushing into an easy, automated process, we are empowering children to be independent, which is really what every parent wants their child to be, whether neurodivergent or not. They want their children to be able to stand on their own 2 feet, be as independent possible, and to have their routines that keep them healthy. So it's an easy way to increase our patients' self-confidence, their independence, their efficiency, and their health. It really does it all. Do we have any questions? I don't know if any are coming in on our...
I will read one. One came through. Are there any recommendations for children with severe gag reflex?
So children with gag reflex, it's really a matter of training them and starting moving more anteriorly and slowly moving more posteriorly. Oftentimes when they do have a gag reflex, the fact that they can hold it themselves as opposed to somebody else holding it in their mouth decreases that reflex. It's something psychological, and I have it myself. If someone tries to take an x-ray on me, I can't do it, but if I'm holding it, they can do almost anything. So the Willo can actually help with that reflex because they have more ability to hold it and position it and feel that difference. And the fact that it's the top and then the bottom, it can help decrease that that gag reflex. The fact that it's not foamy because it's SLS-free can also not trigger the gag reflex as well.
I don't see any other typed questions, and if anyone else wants to raise their hand, I can allow you to talk. If I allow you to talk, clicking the button, I mean. Okay. I don't see any hand raised. Oh, wait. Paige?
Hello.
Hi.
Are you able to hear me? Good afternoon. Thank you for this wonderful webinar. I have learned a lot from it. I would like to know how I may be able to get this product.
Sure. Go to willo.com, WILLO.com, and you can also follow on Instagram, which also has a call to action. It's Willo Cleans.
Okay.
Oh, here it is. Excellent.
You can also find us on Amazon. So you can find us both on willo.com or Amazon if you want to purchase the product, or reach us through willo.com/dental professionals, and reach us on our social channels as well. We would love to hear from you.
Okay, thank you so much.
Thank you for your interest.
Mm-hmm.
Any other questions? Anyone else? I don't see any other hands raised. I want to thank everyone for attending, and Dr. Carter, thank you for sharing this really helpful information. As a parent of 3 kids myself who use Willo, I have seen firsthand the benefit, but it's really tremendously valuable to hear from dental professionals like yourself in terms of your experience and how Willo makes a difference in your practice. Appreciate everyone's time today.
Great. Thank you so much.